today's session, fight COVID second wave, especially in today's, if we look at like right now, there's a lot of cases are going up, and many people are getting affected, and we are hearing a lot of sad news. So this is really tough time that India we are going through. So really difficult times, but there is actually a lot of things we are hearing the news on the some tips how to overcome corona and all, and still we are seeing a lot of chaos. But from last year April onwards, we have been listening to Dr. Bhanu Prasad garu. He's talking about vitamin D, which is actually playing an important role, especially in fighting COVID-19, and we can recover easily. And vitamin D3 can play an important role. That's what actually he has been telling in many forums. And I think last week also we had a session with Dr. Bhanu Prasad garu in Telugu. So now we're going to discuss some of the things how vitamin D3 can help us in overcoming this COVID in this particular chaotic situation. So before that, I request participants, at least if you can able to switch off your videos, that will be very helpful, because sometimes some kind of distraction some of the audience is expressing. So please, if possible, turn off your videos, and that really helps even in the bandwidth wise, because many people are joining, and that will be helpful, right? So let us go to quickly the main objective of today's session. Yeah, this is how we go. So like we'll have a testimony from COVID recovered people using vitamin D3. So there are testimonies. Even one of the doctor who is going to share with his experiences how people got recovered using vitamin D3. We will listen to that. And second is the reasons for second wave seriousness and spread. Why this much of spread we are seeing in India, especially because in the first wave it is not that much spread, but we are seeing a lot of people getting infected. So what is the reason? Is there any variations in the coronavirus itself? So those aspects we are going to discuss. And third, vaccination related challenges. So there are some confusions on that, and we are going to discuss. And fourth is the role of vitamin D3. How vitamin D3, by the way, vitamin D3 is not a medicine. It is actually part of our immunity system in our body itself. That's one of the vitamin. So how vitamin D3 is going to help us in overcoming corona. So those things we're going to discuss. And next, this is one of the important, because in all this discussion, ultimately we have to understand how to take vitamin D3, especially in these times. So I mean, I want all the participants be available till 5th point, because that's where you will have a lot of takeaway. So I request everyone to just take that notes, and you can just keep with you, and so that it will be helpful. And 6th point is fears and doubts and questions on taking vitamin D3, because there are a lot of confusions and fears. So we're going to have that. And finally, we are going to have question and answers. Most probably, if time permits, we are going to directly give option for the participants, at least 3 to 5 participants. They can unmute and ask the questions. And if you have any questions, you can put it in the chat, or if you are following in the YouTube, just put it in the comment section, so that we can pick up those questions, and we will ask Dr. Bhanu Prasad garu, who is with us. So let me quickly introduce. With me, myself, Prakash, and with me, Brother Emmanuel. We both is going to lead this session, and we have Dr. Bhanu Prasad garu, and he's actually from India, and past 30 years he is staying in US. Currently he is staying in New York. So he studied his post-graduation from University of Hyderabad Central University, and he did Doctor of Pharmacy from Creighton University, and he has three pharmacies, and where he's actually running, and he's the president for Long Beach Chemist. So, and especially on the food side, especially the pesticides, how actually the foods that is getting damaged, and where we are not able to get the vitamins and the minerals. So that is the area that Dr. Bhanu Prasad Garu is researching. So especially in Corona times, he actually went through the total system. So because everywhere we are listening like we have to boost up our immunity system. So then he started research, and he started founding a lot of things, especially vitamin D3, how this can boost up our immunity and we can fight COVID. That's really amazing, and a lot of testimonies, and many people actually approaching him, and a lot of people are getting recovered. And definitely we're going to have a good amount of information. We can understand what is actually corona, the behind what the pathology, how actually the virus progresses. Those things he'll explain, and we can have the discussion. So Dr. Bhanu Prasad Garu, thank you so much for joining and taking your time early morning and joining. So thanks Andy. And let's move on to so we have Mr. Sudhakar Reddy, and he's the founder and CEO of Plus India and Beulah Biomedics, staying in Hyderabad. And he is actually, in the medical formulation past 33 years. He's been in that industry and marketing 600 plus medical products, exports to African countries and even in India. So there is a lot of, exposure. And at the same time, in these times, he's also been involved how vitamin D3 is helping the people. So why I'm saying vitamin D3 continuously, because there is a reason, and definitely we are going to discuss on that. So thank you, Sudhakar Reddy, for joining. So now we're going to listen how vitamin D3 has helped the patients to recover. We're going to listen a testimony from Dr. Vijay Kumar. Dr. Vijay, he's an MBBS doctor, and he's working in an MNC in Kakinada. He's an industrial occupational health doctor. So I think he'll share some good amount of testimonies that he has worked with. So may I request Dr. Vijay, can you please unmute yourself and share your experiences? That will be really helpful for all of us. Thank you so much for joining in. Thanks.
Yeah, thank you, Prakash Garu, for giving this opportunity. I really thank God for giving this opportunity, and as well as working with Dr. Bhanu for the past 10 months. So vitamin D, it happened to play a very, very important role. I mean, in many people's lives, whose lives have been saved. Okay. So I am a occupational health physician working in one of the MNCs in Kakinada. So for the past 10 months, I happened to encounter many miracles in our place. I mean, many people were recovered from their seriousness. I mean, where they went almost to deathbed and recovered. I mean, I would like to start with my own testimony with vitamin D. Initially, I was also hesitant in taking vitamin D or accepting what Dr. Bhanu Prasad Garu has told. But when I have seen results in one of the employees who was a 28-year-old employee who had chest congestion, breathlessness, and on the advice of Dr. Bhanu Prasad, I had to give him on higher doses of vitamin D, and we have seen immediate result. I mean, he got recovered from his breathlessness. Then I thought, I mean, yeah, this is the drug, I mean, which is doing some, which is producing some results actually. So then I started giving to my patients, giving to my employees, whoever has taken vitamin D as a preventive aspect, who are maintaining 80 to 100, they are not even getting any symptoms of upper respiratory tract or COVID symptoms, whatever it is. No one is getting. I can say about my own family. My father is a heart patient. I mean, he's stunted actually. His heart is compromised. My mother is a diabetic. But still now they don't have any symptoms, any sort of symptoms. Me also, till now I didn't get even cold also. So I can say with that. I mean, also, I would like to share some testimonies. I mean, whom I have treated. So the first one is one of our employees' father. I mean, all were managed. Most of them were managed at home only. Okay, he is a 58-year-old person, male person. So his sats have been saturations have been got down. I mean, by 80 or 85, 80 to 85. They were maintaining at 80 to 85. Then he had to call me. Then I asked him to give vitamin D in higher doses, like 5 to 6 per day. Initially, I didn't know. I mean, higher doses can be given, so that was given actually. So that patient got recovered within 1 week of time, and we had given about 10 lakh international units for that patient, and he got completely recovered within 2 weeks. And the second one is my father's friend's wife, who was a 60-year-old female patient, and her stats were saturations gone down by 70 to 75 between they were maintaining. Then they had to call me, and I asked the advice of Dr. Bhanu regarding this. Then he asked me to give a 6 lakh international units of vitamin D immediately. I mean, we had to give that, and immediately her saturations have increased to 90. And then on, we maintained the saturation levels by giving the maintenance doses. And she got completely recovered within 15 days of time. And the third one is 45-year-old male patient. I mean, he is a heart patient. I mean, in Bangalore Government Hospital. This happened just 2 weeks back. So his saturations were, I mean, 2 weeks they were in home only. And after 1 week, that patient had taken even vaccination also. I mean, vaccination. After 1 week of vaccination, I mean, his saturations were down to 80, and they have taken him to the government hospital. So as they have taken to a government hospital, it was easy for us to intervene. I mean, so that we could give vitamin D treatment for him. We have given more than 20 lakh international units for him, and now he got recovered well. I mean, we are seeing many patients who are getting admitted and getting treated in various hospitals and ending up in ventilators. And here I see one patient who is a heart patient, and is getting completely recovered after giving vitamin D. That it was really a miracle, actually, I should say. And the other patient is a 60-year-old male patient in one of the private hospitals near Guntur. They are relatives to me only. So they they were there. I mean, the patient was there almost in the hospital for 2 weeks. And as his saturations were going down, I mean, they had called me at the last moment, what we have to do. Like, then I asked them to give a 6 lakh international units vitamin D immediately. And within 1 hour, the saturations have improved to 92, 93. And they were really surprised. Even the doctors were surprised what happened. I mean, how the patient got recovered. And the patient got completely recovered now, and is on a maintenance dose. And the last one I would like to tell you about is a female patient, 70-year-old female patient. She's very much malnourished, and she suddenly developed breathlessness, and they had to take her to a private hospital where they tested her and found to be COVID positive. And as the beds were not available there in that particular private hospital, they didn't take them. So they had to go to the government hospital. And that friend of mine, he called me what I have to do. Then I asked the advice of Dr. Bhanu Prasad. Then he asked me to give IM injection, as she was not able to take orally, as she was gasping, almost like it was last moment. So we had to give IM vitamin D 6 lakh 6 lakh international units, and she got recovered within 1 hour, and now she is completely well. I think Dr. Prakash can share that video of that patient,
Yeah.
who got recovered?
Yes, doctor. I'm going to share that. Sorry, just give me a minute.
Yeah. So it's really a miracle drug. I'll say, I think as there is lot of shortage of oxygen, I think this is before we gave the vitamin D injection. I'll just show the patient. This is the situation which she was in before giving a vitamin D injection. She was gasping, I mean, in the last minute, I suppose. After giving the injection, you can just see.
Yeah, so this is like a 6 lakh unit, right,
Yeah.
doctor? You have given.
Yeah. This was after recovery. Whether audio.
Yes.
Yeah. So that was the thing we have seen. I mean, I have shared only the patients who are more than like 50 years old. Actually, we have given to many patients, many persons, I mean, outside, who have recovered well. I mean, many of us may say that they are young, they may not encounter severe disease. So that's why I have not shared those testimonies. Actually, there are many people who got completely recovered of young age. So that's why I have taken the people of older age and shared their testimonies who have recovered really well. I mean, not even one case, I mean, was it ended up in deathbed. So those who hesitated really to take it, they ended up in deathbed. Actually, many people I have seen with my own eyes. Yeah, that was my testament. That was my experience on vitamin D. Thank you.
Thank you so much, Dr. Vijay Garu. It's really amazing because nowadays, right, when we are talking about vitamin D3, so everywhere we are listening like weekly once only. Don't take higher than that. In that situation, so you understood and you really saved many people, right? That's really amazing, and you came forward and helping and talking to us. That's really amazing. Thank you so much, Dr. Vijay, for sharing wonderful experience. Yeah, I think this is one of the good testimonies that we want to have going forward. So let's move on to the discussion. So I think with me I have Brother Emmanuel. So he's going to lead us why actually the spread of this coronavirus in India, and especially in this second wave, and vaccination related questions as well. So over to you.
Yeah. Thank you. Yeah, thank you so much, brother. And thank you so much, Dr. Bhanu Garu. We are really privileged to be connected to you. I think you are a blessing to many during these tough times. Thank you so much once again. So as we get into time of knowing more about the things what many are facing these days. So my first question to you, doctor, is like what is the difference between the first and the second wave, especially in terms of the intensity? Are there any specific reasons why this huge surge in people being affected in India, especially? So, can you please put your thoughts on this, or just give us some insights on this question, Doctor?
Yes.
Thank you.
Yes. Thank you so much for having me here, and that is a very important question that we must address, because there seems to be a lot of differences between the way the first wave was spreading and now the second wave is spreading. Back in April of last year, we did not even think that this is going to affect us to the extent that it did. In April, we were having probably hundreds of cases a day, And later on, when it came to May, June, July, the cases started picking up quite a bit, and the number of cases last year peaked in September around 93,000 per day. So after that, the incident started going down, and it went down and until all the way up to January. That is when we started vaccinating people. Mass vaccination started rolling out in India. As the vaccination was going on, what we saw is the cases started picking up. Okay, it may be a coincidence, maybe there is something to it, but something that needs to be addressed, and that needs to people need to think about these things. Okay, so and as the vaccination went along, and last year what we saw was about three main strains were prominently talked about, and this year on March 24th, there was a report by Ministry of Health. They examined 10,900 samples, and they isolated 771 strains. So there is a difference in that. Yeah, we are dealing with a lot more strains this year, this second wave, than the prior wave, that the first wave that we dealt with last year. And in last year, the initial symptoms and the progression of this disease was, first 10 days of the disease was very mild, and the next 10 days of the disease was a little bit complicated, and that is what has brought about many complications of respiratory system, and the pneumonia, bilateral pneumonia, and slowly lungs getting compromised as more and more oxygen is being given, more and more is demanded by the body, and that is how we have seen the cases progress. But this time around, what we are seeing, according to doctors' testimonies, is people are showing up in the hospitals with a lot more lung involvement in just up front. Okay? There is a lot more lung damage, and 50%, 70%, 80% involvement, and the cases are progressing very quickly. And it appears as though that first 10 days of that first 10 days may have disappeared, looks like. And also in some people, there is first 10 days and for the second 10 days, the demarcation point is this bilateral pneumonia developing in both lungs. So I think, and also we know that the spread potential of this disease is tremendous. That is what in epidemiology we say it is or not. And one person, how many people can this disease spread from one infected person? And that is very high in this. And also and the way this is progressing, now we are dealing with about 4 lakh cases, daily cases. And also the death rate also has gone up. So I think there are some differences between the first and second wave. That is, the things getting serious very quickly. So it appears as though this immune system, is locked and loaded, and it is reacting much more aggressively this time around. That is what we are seeing.
Thank you very much, Doctor, for your wonderful insights on this question. Further to what you were explaining in terms of the severity, in this second wave, what we have seen is there are people who are having some symptoms, or initially there are symptoms, and then they are going into the severity or something of that sort. But there are people who do not have any symptoms, but in a day or two, they are just going into a difficult situation in terms of their lungs being affected to at least 50 to 70%, and then they are going to the hospital. So why is this happening, doctor? What is this? Because the person is absolutely fine, and then in a day or two, he's going into critical condition. So can you please help us to understand this kind of things?
Yeah. And to understand that question, to understand that issue, we need to understand that this is not about the virus. Okay, it is not fully, the disease itself is not fully about the virus. There are 90+% of the people who get this disease and get over it very quickly without, some people even may not even realize that, they have this virus in them. And when we measure their antibody titers and they show up positive. Okay, so this virus, it is not the virus that is becoming fatal. Okay, but virus is starting a cascade of these immune reactions in the body, and those immune reactions, see, that is like it is. I would like to say that it is virus is activating the immune system, and also in some by some measure, this viral replication potential is almost 3 to 4 orders of magnitude higher than the previous viruses that we have seen. So it can create a massive viral load in a very short amount of time. What that does is it activates the immune system to a point where immune system has to respond so quickly. And the problem with that is, if the immune system is dysfunctional, if the immune system is not responding properly, if the responses are not appropriate, that is what causes the most damage to the host. Okay, and if the immune system causes this, extremely hyperinflammatory state, and that is what is causing massive inflammation in the lungs, and that is what is, causing the lungs to quickly fill up with the fluids. And so to speak, it's just it's like a patient is drowning in their own fluids, and these secretions are so thick, and it is very difficult for them to clear out of their lungs. So, and also it is like the immune system active. This has been documented in the previous SARS and MERS illnesses, where this immune system, there were SARS and MERS vaccines that were tried before, and they did not get to the market because of the safety testing issues. They did not pass safety. Okay, so what we have noticed is this immune system, when it is locked and loaded for this response, okay, and when it is challenged with this kind of a challenge of a COVID, which the the replication potential is so high, the viral load quickly becomes higher and higher and higher, and immune system responds, just extremely aggressive way. And those immune reactions can proceed in multiple ways. One is anti-inflammatory pathway and the inflammatory pathway. And if they proceed in the inflammatory pathway, that is where the problem is. That is where the problem is. And it causes massive inflammation in the lungs and in all over the body, and causes multi-organ failure within no time at all.
Thank you, Doctor. Wonderful. Thank you so much. Again, there is one kind of typical situation we have come across. Like there are a few instances where we have seen that the test results are negative, and in some cases the symptoms are there and they are waiting for the results, and after 1 or 2 days the report is negative. So in these cases, how foolproof we should think that these test results, especially this RT-PCR or this rapid test, all these tests, because what happens is there was one instance which was covered by the news channels also in Nizamabad, a person who gave his tests and he was just waiting outside this pathological laboratory, and he just collapsed and died. So these kind of things, they are really alarming, and we are not able to understand what is this happening. So can you please put some highlight on this as well, Doctor?
Yes. Okay. So we have seen this kind of stories from China also in the last year. People just walking in the streets and dropping dead. Okay. And one thing is for sure, this is even though 90+% of the people recover from this, okay, this is an extremely complex disease. Okay. And see, the thing is, once the virus is replicating inside and the immune system is activated, once the immune system takes care of this virus, there may not be any viral load left after 5 or 7 days in this illness. Okay. And that has been proven by some studies in here in the US, in Virginia, and in New York, Langone Medical Center. If after 5 to 7 days, there is no viable virus in the body because the immune system has eliminated that virus. Okay? But the problem is that immune system is still active, and it is actively generating this inflammatory cytokines. Okay, cytokines are the substances that body uses, the immune system uses to combat the invading organisms. Once the invading organism has been taken care of, that immune system is still active. That overactive immune system, that hyperactive immune system, keeps on generating these cytokines, and those are the ones which are causing massive injury, acute lung injury. And that is what is happening. And these, when we are relying solely on these tests, the problem is when the test means, if the virus is present throughout this illness, those tests make sense. Okay? But if the virus does not, if virus has been dealt with by the body and your own immune system, that virus is eliminated, the test can become negative. Okay, but the problem is, we need to be testing more. We need to be testing for the inflammatory markers. If there is inflammation, even though the test is negative, the viral tests, RT-PCR is negative. If there are inflammatory markers that are going up, there are IL-6 and D-dimer and CRP and LDH and ESR, all these things, if there is going up, like there is a raging fire in the body because of this dysfunctional immune system. If they keep on going up, you must assume, and if there are symptoms like, shortness of breath and, discomfort in the chest when taking a deep breath, those are the things, telltale signs. Do not wait for the test to come to make sure that you are, you're positive or negative. Positive, negative does not mean a thing in this. Because so many people who have been tested negative, after being treated in the hospital, they went home to their deaths after 10 days because the immune system is still active, and it is actively generating these cytokines. Okay, and IL-6, if it keeps going up, you better pay attention. Okay, and don't just rely on your RT-PCR test. Okay, have your doctor do these other tests, inflammatory markers. Take a look at them, what is going on. And that unfortunate incident in Nizamabad where the person is waiting for the test outside and test came negative and he died in his mother's lap. Okay, how do we reconcile with this? Okay, we cannot reconcile with this, with incidents like this, unless we get to the bottom of this. Okay, unless we really understand what is going on. Okay? It is not about the virus. It is about our own immune system. It is about our own dysfunctional immune system. Okay, if we can understand that, okay, then the rest of it will be easy. Okay? Then the question remains: how do we fix, or how do we address this dysfunctional immune system? Then the answers will flow. Answers that make sense. Answers that are consequential will flow out of that realization.
Wonderful.
So,
Yes.
sir, actually, I just want to interrupt here. So, like, for example, if I understood correctly, because even I have discussed with you and I went through the YouTube videos also, what I understood is the moment the virus actually get into the body, it start, replicating, right? So this is actually initial days, like, 3 to 4 days, this replication, heavily happen. And at that time, we may feel like, like fever or some kind of cold or cough, or, sometimes we may not face any kind of symptoms as well. But people are actually, start, go for the test slowly and they give the test. So you mean to say by the time we gave, the immunity system already killed the virus, but the immunity system got dysfunctioned, and that is generating the cytokines, which is actually accumulating in the lungs. So that is causing actually inflammatory mark, so that we can able to, test better and we can deal with the virus. That's what actually I understood.
Yeah. See, the thing is, this is it's very complex because it's in different people, the presentation is very different. Yes, in persons with a dysfunctional immune system there are many mechanisms in the body to deal with invading organisms. Okay, all those mechanisms are dependent on our cells functioning in the way that they're supposed to and they're designed to. And if they do not, the problem is in some people, the viral replication can be extremely high. And in some people, the viral replication can be extremely, very, very contained. And I think we will, and as the discussion moves along, and when we come to vitamin D, I think we will understand what is that difference due to. Okay, once, see, thing is, by the time the test is done in some people, yes, then people will experience flu-like symptoms or a common cold, and they'll start thinking, no, it is not, because we are when we are dealing with a pandemic like this, a disease which can kill a person within 10 days. Some people will be just walking the day and probably even hungry and eating, and 2 days later, 2 hours later, they are no more. And if when we are dealing with a situation like this, people are filled with so much fear and so much trepidation, and they assume that, okay, it is human nature. Yeah, we don't think the worst of things can happen to us. Okay. Yeah. And also all the body signals will point to that point. And there are so many distractions in this journey where we start, when the person is infected to the point where, the person is suffering from the respiratory symptoms. Okay, there are too many in this journey. There are too many points and too many distractions. Some of these distractions I'll point out to you. One is the fever. Okay, and people are so worried about the fever. And don't worry about the fever, because that is your normal body's immune response. If some people are not getting febrile when they're exposed to bacterial endotoxins or viral endotoxins or the wild viruses, we need to be concerned about them because their immune system is not functioning properly. So fever is one of them, and diarrhea or nausea. These are all distractions. Okay, the main battle is should be fought at the point of lungs. We need to protect our lungs. Okay, once we protect our lungs, most of these things will fall into place. Yes, as you have asked, as you have rightly observed, even though the body eliminates this virus by so many mechanisms, okay, even to the point of RT-PCR, it's a very highly sensitive test, and RT-PCR, if it becomes negative, then there's not much of viral load left in the body. So, but people are dying. Why? Because the immune system is still active. The immune system, see, we have an immune system that is so beautifully designed and so wonderfully balanced when it works properly. When it does not work properly, it can go haywire and cause so many problems that we are facing in the modern times.
So that means, the moment the virus actually, get into the body, within very few days, it's going to go out of our body. It's going to be die. But the problem is the dysfunction of that immunity system, which is not properly working. That is actually, damaging to us. Absolutely. I think last time also you gave a wonderful example, doctor. Like, you said, like, the soldier, actually he has to, protect the country, and where he was given weapons. But if his eyes was closed, then if he can use that weapon, and it can damage own people as well, right? So yeah, that's how actually it affects. Yeah. Go ahead.
The thing is, the immune system is like a security force that is charged with protecting the nation. And that's wonderful. If there is an enemy attack, this immune system, so to speak, the security force can successfully eliminate it if it is functioning properly. If not, what happens is, we can give them all the weapons that are required and all the, so-called, the antivirals or anti-enemy tanks and all those things. If we can provide them with all those things, and if we blindfold the army, okay, then they will not know whom they're using these weapons against. And if that is the case, that can cause massive damage to a nation, a country, and those weapons can be turned against our own people. And that is what is going on. That is the perfect analogy of what is going on in the body in the COVID disease.
Thanks, doctor. Yeah, Emmanuel,
yeah.
can
yeah. Yes, yeah. Thank you, brother. Thank you, doctor. Yes, very thoughtful, thought-provoking and thoughtful insights you have given us, doctor. Thank you. Now we will go into our next section where I think we are all really happy that we have good news that vaccination is out, and yeah, many are trying to take it. But My question is are there any instances that people have come to you with the following things? Like I will just put it like this, like uh, after taking vaccination, has anyone come to you asking for a consultation in terms of they have developed heart related complications, or there are few people they think that if I take a vaccination, do I do I have any side effects or any other complications, related complications? Or if some people, are there any instances where people have come to you asking that if I take vaccination, still I be affected with COVID? Or are there any instances people have come to you that they have taken vaccination and they are no more because they are being affected with COVID
Yeah.
again?
Yeah.
So have you come across these instances, doctor? Can you please put some highlight on this? Thank you.
Yes. Now, before answering that question, I'd like to say a few things about how the journey of of our journey of humanity uh, came to these vaccines. Okay. And in last year, when feverishly all the companies and all the scientists, whose goal it is to save lives, they have been feverishly developing these vaccines. Okay, we heard that after the vaccines come, okay, there may not be any need to wear masks, or there may not be any need to for the lockdowns, because we would have successfully eliminated this virus, as we have, as humanity has in the past, has successfully eliminated some pandemics like smallpox, and which is no small feat, and polio, and which is all but history. And there are very few cases of those happening around us. So I think when we were thinking about these vaccines, I think people had those in mind, that a generation ago, when all these maladies were completely destroying humanity, and the scientific advances through vaccination did save the day. So that is what we had in mind. So there won't be any need once the vaccines come. There won't be any need for this. And later on, as the vaccines were being administered, quickly those things have changed to, yes, reinfection is possible. Infection is possible even after the vaccination. So humoral immunity, the immunity that develops from the vaccination or the wild virus, and that seems to be fading away in some people in as little as 2 months. And people who even got infected with the wild virus and successfully came through it and developed strong antibody response and antibody titers in their body, they themselves have lost that humoral immunity, and those antibodies went down and they got reinfected. There were cases of reinfection several times. Okay, so with that said, and the studies, the scientists who studied these vaccines, and the initial studies, they also came to the conclusion that humoral immunity from the vaccine may only last up to 2 months, and later on it was extended to 6 months. And so they were applying various metrics to come to these conclusions. So, let's say if it lasts from anywhere from 2 to 6 months. Okay. So with that context, I'd like to address your question. Yes, there are so many people who came to me regarding post-vaccine complications, and also people who got tested positive, not only positive, who have gotten the full-blown COVID symptoms, and they ended up in the ICUs, and some in the last last 5 days, about 10 people who were vaccinated lost their lives. And we have been hearing about these things, and doctors, very young doctors, losing their lives after the vaccination. We have come across all this. And also you asked about the heart inflammation. Now, I have not heard personally a case of heart inflammation, but in Israel, what they're dealing with now is people who have been vaccinated are suffering from myocarditis, the inflammation of the heart muscle. So these are all the things that we need to take on balance, and we need to examine. Yes, if something works and if there is a therapeutic that works, we need to quickly roll it out so we can save people's lives. But if we if we need to examine how it is affecting us, And as the data is coming in, I think we need to quickly, because this disease moves so quickly, I think our analysis also has to move very quickly to come to conclusions that are consequential. And if we come to wrong conclusions about any of these, and we would risk losing large swaths of population in India and around the world.
Thank you so much, Dr. Garu. Very thoughtful insights you have blessed us with. There is one more like school of thought which I would like to help us understand that if we take vaccine and it is like we are it is nothing but we are inducing dead cells of corona into our body so that antibodies will be generated. So when the real corona comes, these antibodies will attack and you will be saved. This is the school of thought. As we know that these antibodies will become weak after 2 to 3 months, maybe in terms of taking a vaccine or these antibodies. So how can we overcome these kind of challenges, Dr. Garu?
Okay, see, what we are dealing with here is when we are talking about antibodies, okay, we are dealing with a specific part of the immune system called adaptive immune system. That is the learned immunity. That is a specific immunity, okay, and that immunity is specific to a particular pathogen. Okay, this immune system, once we are exposed to either to cells or RNA or some that is introduced through the vaccine or through the wild virus, okay, this specific immunity, okay, gets hold of this and takes a look at it and studies it and develops these antibodies so that that virus can be successfully eliminated afterwards. Once that B cell activation happens at the end of this cascade, that is where the antibodies are generated. These antibodies, when I said specific for a reason. Okay, these are specific against a particular pathogen. And let's say if there are any mutations in that pathogen, okay, or any mutations in the genome or in the RNA of that pathogen, these antibodies that are generated may not be effective against those. Okay, that is something that we need to consider at this point. Okay, when we see these mutations happening, okay, in post vaccination, like and there are 771 strains as of March 21st out of 10,900 samples. So what are we, what we need to understand is the humoral immunity that is coming from the vaccination. Is it active against these antibodies? Are they active against these new strains? See, we have flu vaccines, okay, and the flu vaccine that is developed for this year is not going to be effective for the flu next year because of the subtle changes in the viral genome. Okay, and if that happens here, and if we are dealing with this massive amount of the variants, we need to think, the humoral immunity that we get, the antibodies that we get, are they effective? Okay, that is first thing. And as you mentioned, are they the second question that we need to ask is, are they lasting? Okay, what is the durability of those? Okay, and the third thing is, what we need to understand is the same processes, okay, that will take us from point A to point B. See, the thing is, in medicine, what we need to understand is we have to, once the patient is infected, there is a course that we take them through. Okay, we need to take them from point A, where the patient is in danger, patient is infected, to a point B where patient is safe. We have to land the patient safely on the other side. Okay, all this pathway that we take him through, okay, is extremely important that we need to consider. Whether it is the wild virus that we're exposed to, or if it is the vaccine that we're exposed to, this pathway, all the immune reactions that have to happen is the same. And all the processes that are controlling, that are modulating these processes are the same. So we need to, I think we need to understand this process. What is controlling this, and what is making it effective? And in some people, what we need to be studying is, in some people, they are very effectively, without even suffering any consequences, they're able to reach from point A to point B. We need to be examining those to be able to save many lives.
Thank you, doctor. Thank you. Yeah. My last question in this section is, Brother Prakash, you have anything to say? I have one more question in this section.
Go ahead. Maybe after that, I'll ask.
Yeah, wonderful. Yeah, Dr. Garu, like currently we see that compared to other countries, our India is affected like anything. Like now, other countries are looking up to India. What next India will do in terms of this surge of cases we see and deaths, and we are not able to. People are not able to get beds, or now not able to get vaccination also, because I'm in Hyderabad now. There is a lot of scarcity of even vaccination. People are unable to get that. So why is this surge in India compared to other countries? Is it because of lack of vaccination, what we see right now, or lack of awareness of people how to about the precautions, and especially helping themselves with the increasing their immunity in their body? Or please help us understand this, doctor. Thank you.
Yeah, I think the same question I have.
Okay.
I think here is the gap actually. Now, why we have this much of spread? Because in the first wave we have so much of spread in the other countries, and now India has a lot of spread here. So where is actually gap? Can you just explain? I think that will be helpful.
Yeah. And according to some measures, that what we have seen is in India there are 8 beds, hospital beds for 10,000 people. Okay, and that is not so. We see that is a number that should cause a lot of concern. And also population dynamics in India are a lot different from other places. The population density is a lot higher in India, and also as the first wave rolled along. And once we have gotten gotten off of that peak in September, people started growing very comfortable with this disease, and so much so that the cases have dropped off. And by January, the number of cases are almost negligible. I'm sorry, negligible. So yes, people did become negligent in their, and they probably did let their guard down, and that is when the second wave hit, and that is the reason why it is affecting more and more people, because because the R naught in this is extremely high. One person can spread it to multiple people, and also it can the spread can be asymptomatic. Okay, in other countries, in the country like the US, I think there are. I think people have learned the lessons. I think previously, in the hospitals, there is the management of these patients is a lot different than it was in the first wave. But unfortunately, in India, we are using the same techniques that have almost proved to be failures in various other countries. And those lessons we have not learned, unfortunately. Okay, the same things, oxygen and putting people on oxygen, and as though oxygen is the cure. No, oxygen is not the cure. And once this cascade of this immune reaction starts, okay, yes, yes, there are high dose steroids and high dose antibiotics and and along with oxygen. But what we are forgetting is the lungs are being filled with with fluid and extremely thick secretions. We have to find a way to clear it out. And I want to have, there is a deep mystery around this disease without because of the lack of understanding in India, and also the HRCTs. Okay, there is it is being done like there is no tomorrow. Everybody is getting HRCTs, and here in other countries, HRCT is hardly done. It is not done at all. Okay, we people, based on the symptoms, okay, they are they know this is the COVID disease, and it is getting to a point where the lungs are being affected. We don't need this the HRCT report to see the amount of lung damage. In all this testing, valuable time is being lost in India. I think there are some mechanisms and logistics that are being totally missed in India, which is landing people. People are waiting for the test result, okay, while suffering from all these symptoms. You know what? When we are suffering from these symptoms, let us educate people that it is the COVID. They don't need the RT-PCR positive or negative to see whether it is whether they have this disease or not. They do. They have this disease, and they don't have to wait till the CT scan on the 10th day or 11th day or 12th day to see a CT score of 25 out of 40 and almost 60-70% of the lung is involved. And then what do? A person has only 4 or 5 days from that point on. Okay? So there are so many things that are being missed, and unfortunately. So yeah, there is a different. And also one more thing is, this disease from the beginning has affected many countries, different countries in different ways, because populations' dietary habits are different, populations' exposure to the sun is different, populations' lifestyles are different, and that is where we need to be looking at. That is where we need to be looking at. In India, the amount of the chemicals that are used on the foods, on the agricultural things is tremendous, and the amount of metabolic dysfunction that these chemicals are causing is tremendous. We cannot honestly just sit back and say everything is hunky-dory. No, it is not. There are multiplicity of reasons why India is facing our country is facing the trouble that it is in this coronavirus.
Thank you very much, Doctor. Now I think we'll go into our next set of questions. The role of vitamin D3 in recovery. So I would request Brother Prakash to take it forward from here. Thank you.
Thank you. So I think, till now, based on the discussion, so our main problem is going to be our immunity system, because that's where actually the virus caused our immunity system disturbed, right? So I think even in your previous sessions, sir, actually I understood, like, we have to set right our immunity system properly. So that's what actually the main crux in this corona. So can you just help us how vitamin D3 helps in order to recover from this COVID?
Okay.
Yeah,
that is a great question. See, the thing is, I've been alluding to this point from the beginning in this discussion. See, unless we have a real solution to this, okay, we cannot rely on point solutions. We cannot rely on just corticosteroids in high doses. They have, their duration effectiveness is very limited. And if we keep on pumping people with high dose corticosteroids, we have to deal with the consequences not too far from now. Okay. And same thing with high dose antibiotics and all antivirals. Okay, once the virus is gone, as I've explained, once the virus is gone, just giving an antiviral is like calling the fire engine after the house has burned down. I have used that analogy before. Okay, now we have to have a real solution, not just antivirals, or not just the immunosuppressants, not just antibiotics, not just fluid support. We have to have a solution that is comprehensive and complete. Okay, now let's look at how the viral replication happens. Okay, in every cell in every cell of our body there is a nuclear receptor called a vitamin D receptor. That vitamin D receptor expects to be occupied by its complement, vitamin D. Once that happens, that joining happens, vitamin D and vitamin D receptor, okay, wonderful things start happening. Vitamin D receptor is in its role in modulating so many things, not only the immune system, but the genetic expression, gene expression. Vitamin D receptor is a gene expression modulator as well. So there are so many things that vitamin D is a part of, and controls and modulates and makes them work the way they are designed. Okay, first of all, let's look at the virus. Once the virus gains access into the cell, virus does not have the mechanisms or the paraphernalia for it to replicate on its own. So what happens is, once it goes into the cell, it has to hijack, it has to access the cellular transcription mechanisms inside the cell. Those cellular transcription mechanisms are vitamin D receptor dependent. So these are that, and there is a lot of published evidence in the scientific literature. We have to just take a step back and examine all this evidence. All the clinicians, all the doctors, my appeal to all the doctors is, let's take a step back and examine the evidence. Okay. So vitamin D receptor dependent transcription mechanism. So that is what these transcription mechanisms are, the ones that the virus needs access to replicate itself, to manufacture its proteins so that it can assemble itself and multiply. So, and if vitamin D receptor is instrumental in doing that, okay, and if vitamin D gives it the discernment to do what it is supposed to do, and if a person is vitamin D deficient, what happens in that person is vitamin D, these transcription mechanisms can be easily accessed by the virus. And that is where the replication happens. So if a person, the replication, I think one study that needs to be done is, a person who has proper vitamin D levels and a person who does not have proper vitamin D levels, and the replication that happens in these two people will be remarkably different. Okay, so vitamin D helps stop the replication, viral replication, or control the viral replication. So, the person is not laden with massive viral load in a very short period of time. Okay, so that is one way vitamin D works. And the second way is, we have the immune system. We are talking so much about the immune system. Okay, you have the innate immunity, okay, and the adaptive immunity. These are the two branches of the immune system. Okay, in the innate immunity, there are immune cells, and even in those, there is this vitamin D receptor. And if that vitamin D receptor is occupied by vitamin D, and that means if you have proper vitamin D levels, that upregulates some compounds called, there are some compounds, antiviral compounds, and cathelicidins and beta defensins, and these will latch on to the beta defensins will latch on to the viral envelope and start making that viral particle non-viable. Okay, so, and vitamin D is important for the innate immunity to work properly. That is the first line of defense, okay, that we have in our body, that innate immunity. And I've been talking about the adaptive immunity, the specific immunity. Even in that, if you do, there are two ways these immune reactions can proceed. One is Th1 pathway, T helper cell 1 pathway, and Th2 pathway, T helper cell 2 pathway. And Th1 pathway tends to be, it is extremely inflammatory. And that is where the IL-6, interleukin 6 comes from. And Th2 pathway is anti-inflammatory. And see, the thing is, if you have proper vitamin D levels, these reactions predictably and repeatably proceed to Th2 pathway. So if we have proper vitamin D levels, this immune system learns that, okay, you know what, these two branches of the adaptive immunity have to function hand in hand, and there has to be a balance, and it has to, it activates the Th2 pathway as well. And if you do not have enough vitamin D in our bodies, almost always these reactions shift towards Th1 pathway, okay, and generate this IL-6 in massive quantities. And IL-6 in massive quantities is like pouring acid into our lungs. That is one thing. So I have given you three ways vitamin D helps. Now let's look at the fourth way. And in these people, in people who are affected by coronavirus COVID, the D-dimer levels, they go through the roof. D-dimer is a marker that is indicating that there are blood clots happening in the body. Okay. That is coming from the massive endothelial damage that is resulting from this immune system attacking this, even the virus or immune system attacking these endothelial layers in the circulatory system. Okay. That is where these micro clots, microcoagulation is coming from, and that is what is increasing this D-dimer levels extremely high. So now we have seen people with almost 8,000 picograms of D-dimer, and that is 500 or lower is normal. And in these people, we have given, vitamin D in proper doses for 1 day, and we have seen those levels come down from 8,000 or 5,000 to almost 300, 200 to proper levels. So vitamin D can stabilize the tight junction integrity in this in the endothelium, and it can preserve the tight junction integrity and prevent the damage that is happening in the endothelial layers. And the fifth way it works is it stabilizes the respiratory epithelium. These are all, I'm not just dreaming up things and I'm just mouthing it off. This is based on sound scientific knowledge and sound scientific research and published evidence. Okay, that is the fifth way. And the sixth way is in the later stages of this disease, what we have is this is a renin-angiotensin system. The pulse rates keep going up and up and up and up. Okay, and we have these wonderful monitors that pulse oximeters, and everybody is paying attention to the first number, oxygen saturation, and completely throwing away that another important vital piece of evidence, that is the pulse rate. And if it keeps on going up and up and up, that points to these reactions that are happening, immune reactions that are proceeding in Th1 pathway and generating massive inflammation. Okay, once that happens, okay, that is renin-angiotensin system is getting into overdrive, and vitamin D is the perfect modulator of the renin-angiotensin system. It downregulates renin. Okay, you can predictably see if you give it when you have a resting pulse rate of 145, 150 in an adult individual, he is reaching a crisis proportion right there. Okay, and that is when acute lung injury happens and saturations will start going down. Okay, so you can give one dose of vitamin D3 every 15 minutes or so, and within an hour their pulse rates come down to completely almost a normal level. Okay, and saturations also improve. So I have given you in this brief overview of 3 to 4 minutes, I have given you 6 ways of how vitamin D works. When I said we need a complete solution, vitamin D seems to fit the bill, doesn't it?
Okay. Yeah. Thank you so much. That's a great explanation, sir. So I think this is how I understood. Out of all the pointers that you have made, right? So whenever we are actually going for test, especially the respiratory system related, we need to check our oxygen level using the oximeter, and at the same time pulse, because this is what we have been observing, right? So if COVID affected person, the oxygen level may come down 90 or 86, something like that it goes, or the pulse rate may go up like 120 and 130. So like that is going,
yes,
right?
Prakash, the thing is oxygen levels coming down almost precedes this pulse rates going up. So pulse rates will go up even before the oxygen saturation comes down. Okay.
Okay.
So yeah, pulse rate almost always precedes, because pulse rate is an indication of active damage, active processes that are damaging the lungs. So that activity is there. Once that activity is missed, and most of the people are, because if we do not educate people about this simple thing, how to use, this is one of the most useful tools that we have, the pulse oximeter, that if we teach them how to use it properly, and they can, even before this RT-PCR or HRCT can predict the damage, they themselves, individuals themselves, can then see and prevent the damage.
Yeah. So, yeah, that's wonderful point, sir, that you have made, because most of the times we are just looking for oxygen level. Okay, what is oxygen level? Always we are looking at, but because as you have said, the pulse is very important. That is actually initially impacted. So that's where I think everyone who connected, right? So I think we need to check our pulse and at the same time the oxygen level. So ideally, the oxygen level is like 97, 98, and the can you just explain that healthy ranges, sir? Oxygen level and pulse level.
Yeah. The most, yes, healthy range is above 95% of oxygen saturation in the blood. That is what we need to aim for. And in the previous illnesses, like if you have asthma or any other respiratory illness, if oxygen level starts going down to 92, 93%, that is when person knows that they're in trouble, and they can sense the symptoms. But unfortunate thing about this disease is there are so many compensatory mechanisms that come into play and start making compensations so that patient does not feel a thing. Sometimes, oxygen can go down to 70s and 80s, high 70s and 80s, and patient does not even think that there is any problem. And that is when, suddenly, that is the reason why people experience these symptoms suddenly. And people think, no, he was fine not too long ago, probably 2 hours ago, he was fine. And suddenly this happened. And these are the stories that we are hearing from everyone. So oxygen level of 95 or better is good. And also pulse rate is 72 is normal in a healthy individual. If you are an athlete, if your normal may be different. If you're an athlete and if you run or if you do heavyweight training, okay, your pulse rates may be in the 50s. Normal resting pulse rate may be in the 50s. But so you need to know what your normal is, and then you can sense the deviations very easily. And if a person of resting pulse rate of 50, and if it goes up to 70, then that is not a good thing. That's not a good thing. So yeah, there are normal ranges. I think we need to the public needs to be educated on these simple things.
Yeah, thanks, Randy. Thanks for that point, because even I think we all of us, have to understand oximeter is very important, because especially in these times, we have to, purchase that and keep it, in our home, so that we have to monitor oxygen and pulse. That is very important. So I think let's move on to, one point, like, is there any time where D3 is not able to, help us?
Yes. See, the problem is, there are D3 is vitamin D, and all the physiology that it controls. It is a finely balanced system. Okay, and there are vitamin D pathway components along all these pathways. Those components have to work properly. Okay, and when the lungs are getting involved, okay, when we are going around the hospitals and other places, and when we are connected to a mask and a high pressure mask, a non-invasive ventilator, and if we do not pay attention to the real damage that is happening in the lungs, that is a losing battle. Because once these vitamin D pathway components are destroyed, when the damage is so severe, so extensive, where all these components are gone, then vitamin D will not be able to help, because vitamin D has to work on these receptors, and all those receptors and all the cells are damaged, then vitamin D may not help. Yes, once the disease progresses beyond certain point, it is very difficult to bring people back.
Okay. Yeah, so that means we have to early itself, start, focusing on the vitamin D, because if I observe, just look back, because our company also, when actually biomedical tests were happened, so there we found like most of the people having vitamin D is like a 10, 20, 30, all were a deficiency level. And definitely, I think, as you mentioned, this is going to be risky, and where we need to actually come to a good amount of vitamin D3 level that we have to maintain. Let me, connect one of the point, because right now, for the coronavirus treatment, right, we have antiviral drugs, we have remdesivir, and plasma therapy is actually, most of the people are taking. So how actually, it's going to be? So do we need to take antiviral drugs and at the same time vitamin D3, or vitamin D3 is, initial stage? If we start taking that helps, or how actually, in this treatment? Can you just explain, Doctor?
Yeah, what we have seen is vitamin D we said this happens in two stages. And in the first stage itself, if we administer vitamin D, and we can get away with very low doses, and these are very high doses compared to the traditional dosing, but we will be able to once the site before, if we can intervene with a person's care before the cytokine storm happens, okay, we can just administer daily 3 to 5 doses of vitamin D for 4 or 5 days, and we can prevent a person from going into the full-blown cytokine storm. Once the cytokine storm is underway, it can be a race against time. That, having said that, you asked about the remdesivir and other therapies, plasma therapy. Okay. Remdesivir is being considered in India everybody says it is essential to the treatment of COVID patients. Let's just go back and take a look. Let's get their IgG antibodies measured. Most of these people. Okay. By the time the remdesivir is administered, by the time the plasma is administered, patient is IgG positive for the antibodies. Okay, the body has generated its own antibodies. Okay, and still patient is failing. We need to understand why the patient is failing. So even though the antibodies are there, patient is failing. So a person, the goal of plasma therapy is inject some other person who has recovered their antibodies into a person's a person's body, so that if there is any active viral virus replication happening, that will take care of the thing. That is the theory. That is the goal behind that. But if a person, by the time he receives the plasma, he has his own antibodies, why would we want to subject themselves to this the plasma therapy, which has its own complications? The second thing, the remdesivir, when the virus is eliminated by the body's immune system, by the person's immune system, why would we want to give an antiviral at that stage in the game? Okay. Antiviral, if it needs to be administered, it has to be administered when the patient is almost asymptomatic, when the virus is spreading rampantly. That is when it needs to be administered, not when the patient is on the deathbed and gasping for air. That is when there is no virus, there is no viable virus in the body. And that is the reason why remdesivir is not being used anywhere else in the world, okay, during the critical stage of this illness, because initially it has been administered and it has been concluded by several studies that it is of completely no use. So what we need to understand, Prakash Garu, is this. Okay, this has to be a team effort. There is so much mystery around this. We need to demystify the corona treatment, and we need to demystify this corona treatment to general masses, general public, because people need to understand. This is a team effort. Clinicians need to understand. The doctors need to understand. The public health officials need to understand. The politicians need to understand, and the patients themselves need to understand how this disease is progressing. Without this team effort, it is impossible to get to the bottom of this. It is impossible to get over this pandemic. It keeps on getting worse and worse and worse and worse, as it has from the first wave to the second wave. It has gotten worse, and I suspect from now on it can get worse, in spite of so many epidemiologists predicting that we will peak in August. There is no evidence to say that. There is no evidence to say that. I think if we do not understand this, and this is a team effort, and also I want to mention one thing about the hospital treatment. Okay, by the time the patient gets to the hospital, they are dyspneic, they are not able to breathe properly, and they are connected to the 10 liters of oxygen or 5 liters of oxygen. Now they are able to breathe. Okay, so what that oxygen did is buy them a little more time. Okay, and while these reactions are happening and lungs are getting actively destroyed, what? Today it may be okay. Saturation may have come from 75 to 95, but tomorrow, on oxygen, at 10 liters of oxygen, when it goes down from 95 to 75, what do we do? Okay, and we push the patient to the next level. So we give them high flow oxygen. And high flow oxygen, yeah, we restore the saturations. And then what do we do? Then we do high pressure oxygen. And then as a last resort, patient is intubated where mechanical ventilation, the machine is breathing for them. Okay, and we know that it's a foregone conclusion at this point where all the mechanically ventilated patients, the survival rate is extremely low. Okay, so we cannot just keep kicking this can down the line without properly understanding this disease pathophysiology. Okay, and now it is, and also a person once they are admitted to the hospital, you know what? I think the patient's family has to be involved in this patient's care actively, because the chest physiotherapy, it is the lungs are getting filled. It is a race against time. Those lungs, the fluids, they need to be eliminated from those lungs. I think the patient's family can provide the care. We cannot just connect these patients to some machines and monitor them once in 4 hours. We cannot do that. We can't do that. Okay, and we need to explain to the family members. We need to take the family members into this the patient's care, and have them work as a team alongside of the clinicians. I think that would relieve a lot of pressure on the clinicians, and that would just make these patients the patient's family members active participants in their patient's care. So yeah, thank you so much.
Thank you so much, doctor. So now I think here, before going to how much vitamin D3 that we have to take for a normal patient, mildly affected and highly affected. Before that, I just we have Dr. Saroja Satish. So maybe Emmanuel Anna, can you just introduce so that we can hear from some experience from Dr. Saroja.
Yes, thank you. Yeah, thank you so much. A quick introduction. Actually, she's a distant relative of mine, and they are now settled in Saudi Arabia, and they are doing wonderful work there. And she's an HAQ doctor, and also she's also a certified trainer of Dr. Maxwell, John Maxwell. So they have 2 children, and yeah, her husband is just besides her. Is Dr. Satish. So thank you for joining us, Dr. Saroja, and taking time to share your experiences in Saudi Arabia, how this miracle medicine helped, and also in your church, how did this work out? Just give us some insights or testimony around that. Thank you.
Okay. Good evening, everybody. Thank you, Emmanuel Anna, Prakash brother, and Dr. Bhanu Garu. I'm a naturopath by profession, but for past 10 years, I'm in Saudi Arabia with a special assignment. And my husband is working as a researcher and head of the IT department in University Diabetic Center in King Saud University. So I'm taking vitamin D 50,000 international units every week or once in 15 days, because as a woman I cannot expose to sun as it is in India. I have to wear burqa so when I go out of my house. So because of that my vitamin D levels were less, so I was taking vitamin D. And I heard Dr. Bhanu Prasad's lectures in Rakshana TV and through some YouTube links. So because he was advising high doses of vitamin D, I just ignored his talks. So I did not take it. Then I found many of the believers who are taking high doses of vitamin D getting miraculously healed. So I had the list of patients who were affected by COVID, and I was praying for them. Few of them were in ICU, and some of them they were hospitalized for nearly 1 month. But after taking vitamin D, those high doses, they were discharged within 2 days, and they got a lot of relief. And I also saw in Siyasat newspaper, they posted about research results about high doses of vitamin D can escape COVID patients from ICU. So after seeing this, I had a conclusion, okay, vitamin D may help. And in January, my both sons, they returned from Egypt. So because they had an international travel, I was suspecting and I was like very conscious. But that time, for first 2 weeks, they did not develop any symptoms. But I was like very conscious. Then my husband, he had his voice was changed. Then we went to COVID center and we got tested. Then he was positive. Initially, my husband was positive. Then one of my church members, Srikant, so his aunt was in ICU for 1 month. She was diabetic and she was very critical. She was she took vitamin D and she was cured and she was like normal. So I called him and I took Dr. Bhanu's number and I called Dr. Bhanu and we had the discussion about the doses, normal blood level and toxicity and how much dose and how it helps in all the doubts whatever I had. So he cleared very patiently and he gave a good time in answering all my doubts. So then he also advised, that time me and my children, we did not get tested. So he advised me and my sons also. My sons are like 14 years and 16 years old, teenage boys. So he said we also should take prophylactic medication even before getting the test. So next day we started even before the test. So next day we went to COVID center and we got tested, and all three of us were positive. Now four of us in my house we were positive, and everyone was scared to hear. First 3 days we did not inform many of the people, but only the people who had physical contact with us, we informed them and we informed our parents for prayer. So and in our apartment, most of the flats are occupied by doctors, and my next door neighbor, he is director of infection control, so he is in decision making about Saudi Arabia COVID situation. So he used to visit us every day, and he used to check about us. So then Dr. Bhanu Prasad, he suggested us to have a pulse oximeter with us to check pulse and oxygen saturation. So it really helped us, and because our oxygen levels and pulse was normal, we had so much relaxation. So vitamin D is working and all, and also he advised us to do gargling. I'm a naturopathy doctor, so we were doing gargling 3 times a day, and we were taking steam and barley water, kashayam, and we were taking the diet like pulkas, vegetable curry. So we had very less symptoms. My husband, he had cough after 1 week. It was very mild cough on and off, and my sons were asymptomatic, and I had fever for first 3 days. After testing, I got fever. It was also very mild, like 100 degrees. I don't know whether it is because of COVID or with fear, because it takes at least 2-3 days to accept that you're COVID positive, and it's a lot of mental disturbance. For me, it was a lot of mental disturbance, then physical discomfort. So after third day, when the fever subsided, because of this gargling and we were taking herbal kashayam, barley water, the sputum started coming out even without coughing. So for us, I think because we took vitamin D, we did not suffer much. Then when people got positive after us, so many people, they started calling me and checking from Hyderabad, from our Hebron fellowships, and believers in Saudi Arabia, many of our friends all over the world. So they were asking me how we had very less symptoms. So I spoke to them personally, and I suggested vitamin D. So one of my friends, she is a professor for biochemistry department in Arar in Saudi Arabia, North Saudi Arabia. So she too developed symptom, and the whole department, they had COVID. So they all called me, and they took vitamin D, and she had only headache, not even fever. So she had only headache. And one more couple, one more family in our fellowship also. So the brother, first initially brother had COVID, but he thought it is normal fever. And after 10 days, he went for test. So by that time, his wife was infected, his children and their domestic maid, everyone were infected. So the same day, me and my husband, we took vitamin D dosage, which is enough for 10 days. And also these barley, kashayam powders and all, whichever they need. So we also used Himalaya pink salt, which is suggested by Brother Bhanu. So we took as a, like in barley water as a first dose. It really helped to bring out the sputum. So we gave all those things to that family. And when we got the X-ray done, his lower lobes and middle lobes were affected and filled with pneumonia. So he was very afraid. Then his wife is highly diabetic. So for her, we started vitamin D on the day one. So she did not have any problem with COVID. So she was normally recovering. And this brother, he is normal, but because he did not take vitamin D on day one, he got tested on day 8 or 10. So his lungs were affected, and he was so scared, and he called his family doctor in Vizag, and his doctor, he advised him to go to the hospital and get admitted. And when he called Dr. Bhanu Prasad, he advised him to continue the vitamin D, and he will not be like going or admitting in ICU. So within 2-3 days, he was normal. And till now, for whomever I gave vitamin D, no one got admitted in the hospital or went into ICU or intubated. One pastor, along with our family, he also got COVID. So he did not take any vitamin D, and he was like relaxed. He did not go for testing also. So he was so busy, he could not go to testing and did not take vitamin D. He was in ICU, he was in coma for 1 month, and he got stroke. And now he is in US on bed. So we are very sorry for people who are not accepting and hearing. So vitamin D, it is not causing any side effects or ill effects. Till now, everyone is recovering well. Whomever I suggested vitamin D, whomever they have taken, whatever the age, male or female, which nationality. So whoever took the vitamin D, really it worked. And I'm very glad someone among us like Dr. Bhanu, so he's speaking to so many people and giving awareness about vitamin D. I also thank Brother Prakash and Emmanuel Anna. Thank you.
Thank you so much, Dr. That's really wonderful because being a doctor, I mean, having your own understanding on vitamin D, but still you started trying that, and you are seeing the results, and that was really spread to many people, because this is the time where we are seeing a lot of chaos, a lot of pain, and a lot of mental stress that people are passing through. So I think whatever the experience that you have shared, right, that's really wonderful. Thank you so much, Dr. Saroja. And here I just want to share one WhatsApp message, because that is the reason where people experienced how it got, helped them to come out of COVID. And those people actually started interacting with the patients and helping. So let me share one of the WhatsApp chat that actually, we come across. So let me share with you quickly. So here one of the patient, he is actually texting like, maybe his relative. So good morning and praise the Lord to all. My brother-in-law, Mr. A. Mallikarjun Rao Kamam, is declared corona positive, who is fighting for life. Now 30% oxygen levels and coming down rapidly. I request prayer support for all our members. Okay. And next, immediately the next message. So brother, please give him high doses of vitamin D3. It is the only savior now. Please talk to doctors and give him 3 lakh units of this vitamin without any delay. A Christian doctor from New York is recommending this. It's really working and the need of this hour. So this is what actually, took information from Dr. Bhanu Prasad. And now after giving that dose, and this is what the message. Thank you, sister, for valuable information and guidance. Now is without ventilator. Your suggestion is worked out and he is recovering now. Thank you for your prayers. So, that's what actually, we have been seeing. Many people are taking and they are getting, out of the danger. But seriously, there are some people not able to, a lot of fears, but still not able to take. That's one of the, point we want to clarify in these sessions. So let me go to the next point, like, how to take vitamin D3, because I'm seeing a lot of comments are, how much I need to take. I'm a diabetic patient. One person is a pregnant lady. So how to take vitamin D3? So we have prepared one slide, PowerPoint, where we will go through the slides. I think Dr. Bhanu Prasad will help us to walk through those slides, and you can just note down, and later also you can refer these audios. Some people are asking for Telugu. We have already did last week one session in Telugu. You can just follow in that channel. So let me share now how much that we need to take. So, Dr. Bhanu, can you just walk us through different age-wise and before affecting COVID, how much and might be affected and highly affected? So,
see, the thing is, I think if there is any doctors in this audience, they will fall out of their chairs looking at these doses. See, I would, I had the COVID in November of last year. For the first 14 days, it was okay, but I was exposed to 6 people who were sitting, 3 people in front of me, 3 people behind me. I was exposed to a massive amount of viral load. And on the 14th day, I started having, though I was taking vitamin D, 14th day, I was having symptoms of respiratory symptoms, even though my saturation did not go down that much to 92 was the lowest, but I was having shortness of breath. So I was taking I took 65 lakh units in 7 days. So there is and thing is, my level now is about around 150 nanograms per ml. So vitamin D in high doses over the short term is safe. And there are papers, scientific published papers, which say, and 40,000 units daily for over 2 years did not cause any toxicity. And there are so many other publications. You can, Mayo Clinic has published a paper in 2015, which the title of which is "Vitamin D may not be as toxic as we once thought." Okay? Most of the toxicity studies were done with vitamin D2, not vitamin D3. Vitamin D3 is properly converted, properly utilized in the body. Vitamin D2, which is from a plant source, which is not advisable, which does not provide any respiratory benefit, Vitamin D2 can cause toxicity, and vitamin D3 not so much. But we are asking people, to include this in the regimen for 5 days or for 7 days or 10 days, not forever. Okay, that is, and even after that, doing this, 2 months later, get your levels checked. Okay, and also these are all this is all anecdotal evidence. Okay, what we are presenting, all the testimonies. Okay, there are so many churches and so many organizations like Dr. Vijay's organization. Okay, none of them, none of their employees or their extended family lost their lives. And so many churches that I spoke to, and one large church in Visakhapatnam, and 7,000 members, only one death because that person was advised not to take vitamin D, and he did not. So this is anecdotal evidence, and science, because this is so quickly moving. I think we need to understand, every one of us need to understand, I think all the population needs to understand how this can be a team effort in mitigating this disease. There are so many tools in this battle. Vitamin D3 is one very powerful tool. I think we need to properly employ this tool on a short-term basis. So, having said that, yes, these are the doses that have worked well over the past year in age 1 year or below, and also vitamin D. It has to be dosed based on the weight also. This is just a guideline, okay? And what we are giving you is a tool that you can employ along with your clinician, and consider, have your doctor consider all the evidence, and just employ this tool so you can live. And once we are living, we can deal with vitamin D toxicity later, even if it were to be toxic. Okay, but if we don't live, the toxicity doesn't matter, does it? Okay, and there are so many people who are, preserving their kidneys, or the so-called, want to preserve their kidneys from the toxic effects of vitamin D, and they ended up in the grave in 5 days with both functioning kidneys. What good is it? I just want to raise these questions because there is so much talk about this toxicity. Okay, then let's go. So in normal 1 year age or below, that is maintenance dose, 1,000 IU once daily should be enough. And in a mildly affected, 1,000 units 4 times a day for 5 days, then 1,000 units daily. Children very quickly recover from this because their immune system has not learned all the dysfunction, all the bad habits of our immune system, of the adults, has learned. And if a child is having a lot of symptoms, 1,000 units to 2,000 units every hour until they start feeling better. They're not having symptoms or respiratory symptoms or cough and those things. So that takes about, in children, that takes about a day or so. And after that, just come back to 1,000 units 4 times a day or 4 to 5 times a day daily. Let's go to the next.
Yeah. So here, I just want to add one point. Like 1,000 units means in the market, I think we have 1,000 units per 5 ml. There is one brand, and there are some available like 800 units per ml. So we have to see that description, then give. Let's say if it is 2,000, then you have to give 10 ml. If it is 5 ml, is 1,000 units. So yeah, let me go to the next one. 2 to 5 years.
Same. It's the same thing. 1,000 units twice daily. If a child is a little heavier, discuss with his clinician, and you can increase it a little further. Okay, 2,000 units 6 times a day for 5 days has worked extremely well in children affected with COVID. And some children, they were affected quite a bit, and their pulse rates were going to almost 180, 190. And even those children were their saturations, and we were able to, within 3 days, they became completely normal. And in highly affected, 2,000 IU every hour until we see response.
5 to 10 years.
5 to 10 also. To the normal maintenance dose for 5 to 10-year-old in normal weight category is 2,000 units twice daily. And mildly affected. See, the thing is, the vitamin D recommendations, they say 400 units. The problem with 400 units is that was developed a long time ago. That dose was to prevent rickets, and that is I think we have learned scientific there is so much science that has gone on since then, and which points to higher doses of vitamin D, and mildly affected about 3,000 units 5 times a day for 5 days, and then 2,000 IU twice a day after that, and then highly affected 5,000 IU every hour until you see a response in a 5 to 10 year old. Okay, then 11 to 15 year olds, 60,000 IU daily for 2 days. That is for maintenance, to bring the levels up very quickly. I think this 400 units daily, and that paradigm has left all of us, our country and the populations around the world, deficient in this vital nutrient. Okay? And in our childhood, we were exposed to a lot more sun, and our parents used to give us this cod liver oil, which had a lot of vitamin D also. So then we have come away from that, and there is a lot of chemical exposure, and these chemicals can cause a lot of stress, which increases the vitamin D utilization. So then 6,000 IU every 10 days for 2 months, and then get tested. Okay, once you get tested, then adjust the dose going forward to maintain your levels. Okay, when I say maintain your levels, between 80 and 100 nanograms per ml. Okay, vitamin D. This is, I think, with this pandemic and what may yet to come. Okay, we are well past the complacency with vitamin D levels. So vitamin D level, maintain it between 80 and 100 nanograms per ml. Okay, mildly affected, it's the same thing, and 60,000 units twice a day for 2 days, and then every 10 days for. And highly affected, so 60,000 units 4 times a day. That you may not even need to give that much for more than 11 to 15 year old, but more than a day or so. So this is just a guideline. You need to use, observe and use your judgment, and talk to your clinician, and then implement these doses. Okay. And 16 to 18 year olds every other day for 10 days. That is to bring up the levels quickly, and 60,000 units every 10 days for 2 months, and then get tested. And in all these cases, once you recover from COVID, wait for 2 months, wait for 2 to 3 months, and then get tested. Because if you take massive doses now and get tested, you will be scared because of it has reached higher levels. We have measured in all the people that we have given this extremely high doses. We have measured their creatinine and serum calcium and all those things. All the parameters are completely normal. So the vitamin D toxicity is something that should not make us fear, because the consequences, the fearsome consequences of this disease, the immune system going haywire and completely attacking every part of our body, that should be feared the most. Okay, and mildly affected is the same thing: 60,000 IU twice a day for 3 days, and then 60,000 IU every other day for 6 more days, and then 60,000 IU every 10 days. Okay. And highly affected, 60,000 IU 4 to 6 times a day, and then probably 1 or 2 days, and after the response, then bring it back to the maintenance dose. Okay. Now the adults. Okay. Here, this is the thing. This is highly affected means a person is an active cytokine storm. Okay, that is where we need to give a lot of doses until response means the pulse rate comes down and the saturation stabilized. That is when we can go back to these the mildly affected doses. So you can just go through this yourself and discuss it with your physician. And if they are not willing to do it, you know what? It is your life. You make it is. You make a decision whether to use this tool or not. And because in this pandemic, when we are losing, every family is getting affected, I think we need to have an open mind towards things that have proven efficacy.
Yeah. So I think parallelly we have these number of questions we are seeing even in the comments, like people having blood pressure, BP, and diabetic, heart-related issues, cancer, kidney problems, asthma, pregnant ladies, and feeding mothers. And I think last point we will come back. So can these people take vitamin D3, whatever actually we mentioned, the doses based on the severity?
So funny thing is, most of these things, it's not funny, it is very serious and very consequential. Most of these disease processes, okay, if you look at BP, diabetes, heart-related issues, cancer, kidney problems, okay, and asthma, and in pregnancy, vitamin D deficiency is associated, is correlated with worse outcomes in every one of these diseases. Okay, and in my opinion, okay, clinically, we need to, the treatment of any disease has to start with vitamin D correction. Okay, properly correcting the vitamin D levels will, even the drugs start working much better. Even the simple interventions like exercise and proper diet, okay, they also start working much better if vitamin D is properly incorporated into our diet, and also vitamin D levels are proper. So yes, in every one of these diseases, vitamin D can definitely, absolutely, positively help. And also, if any person is affected with COVID, these disease states themselves, they put these people in higher risk of death due to COVID. So yes, definitely they can benefit from high dose vitamin D regimen in them. And also kidney problems. Okay, doctors say, kidney stones. Thing is, another funny thing that I've noticed is everyone who has kidney stones, they're vitamin D deficient. All of them, we got them measured, and every one of them came up with lower vitamin D levels than even normal. So if vitamin D should be the cause for kidney stones, then all these people who are deficient in vitamin D should not have any kidney stones. And in fact, my vitamin D level is 150 plus, and all my children's are 120 to 130 range. And we don't have any kidney issues or kidney problems, and all the parameters are very healthy and fine. So, and with respect to pregnancy, okay, in pregnancy, the complications like preeclampsia are treated with magnesium, and vitamin D can be treated with vitamin D. And in people pregnant women with proper vitamin D supplementation, up to 5 to 10,000 units daily, their pregnancies, the outcomes were wonderful, and outcomes were very positive. And the feeding mothers, there is no question. And most little babies do not, some babies do not thrive. And if you measure their vitamin D levels and mom's vitamin D levels, they are extremely low. And vitamin D correction can help any of these populations.
So on the same note, doctor, so there are people have questions. I took vaccine, but do I need to take vitamin D3, or can I take vitamin D3?
Yeah. So yes, whether it is vaccination or wild virus exposure, the thing that we need to fear the most is this hyperinflammatory response. Okay, hyperinflammatory response is a feature of the dysfunctional immune system. Okay, if that be the case, then vitamin D teaches this immune system these tricks, and vitamin D gives this immune system the discernment, okay, to react properly. So if that be the case, if you're vaccinated, you may not suffer any consequences, or you may be feeling fine. But later on, for about 6 months, and because your immune system is locked and loaded, okay, because it can, there are studies which prove that point. In one of the study that in 2012, okay, the paper published, it says even though those this is about the vaccines developed then using the same technology. Okay, even though these vaccines are immunogenic, that means they are developing antibodies. That later on they observe that they are causing enhanced immunopathologies of the lung. So that means the immune system is just starting, is beginning to, just getting ready to pounce. If in these people, if you are exposed to the wild virus 6 months hence, it may be a problem. So that is the reason why your vitamin D levels have to be maintained at 80 to 100 nanograms per ml. They must, vaccinated people. Also, we need to pay attention to vaccinated or non-vaccinated. We need to pay attention to the vitamin D levels. Thank you.
Thank you, doctor. I think some people are asking in the comments for thyroid people and rheumatoid arthritis. Can these people also take vitamin D3 or not? They want.
Absolutely. Thyroid issues. Some of the people who got infected with COVID, they have started taking. They started corrected their vitamin D levels, and later on, 6 months later, they had to cut down on their thyroid medication. So, we cannot specifically say, there is correlation, but it's in scientific terms, there are we cannot just say it is going to help everyone. But thyroid disease also, it has its origins in vitamin D deficiency. It can yes, and also what is the second one you said?
Rheumatoid arthritis.
Rheumatoid arthritis. See, with respect to rheumatoid arthritis, that is another autoimmune condition where in this, there's one of the cytokines of importance here is TNF alpha. Okay, and most of that, so much so that most of the treatment for rheumatoid arthritis centers around these TNF alpha inhibitors. So this TNF alpha, it is a part of the PH1 branch of the immune system. If vitamin D levels are corrected in these people, if these two branches of adaptive immunity are properly balanced and they respond well, I think rheumatoid arthritis patients, along with their treatment, can experience beneficial results with vitamin D correction.
Okay, thank you, doctor. So I think here, I think one experience when we actually, come across here actually, because of the time, we were not able to give the time to Mr. Sivakrishna, because in his family, there were 8 members. His sister-in-law, she's a 6 months old pregnant lady. So I think she had a COVID positive, and we started giving high doses of vitamin D, and actually her oxygen levels went to 90 and 92 like that. And when we are giving vitamin D3, so then she was able to cope up, and she went for retest after 10 days or 2 weeks around, and it was negative. And she got she had a cough and she was sneezing. Everything has went out, and she is fine. So, and in the same family, his father actually cancer treated patient, and all of a sudden in the night at 11 o'clock, I got a call from Sivakrishna, and he's saying like, my father is not able to take breath, and he's literally suffering. At that time, we contacted Dr. Bhanu Prasad garu, and he suggested 360K tablets at a time. So he suggested to give, and after that, every 15 minutes, 160K we have given, and he suggested for 1 hour. After 1 hour, we got, we come to know that, his father is feeling better, and he's very comfortable. You see, at 11 o'clock, and with this patient and cancer treated, can you imagine the pain and the stress, and how actually vitamin D3, helped them? So I think there is a lot of, these kind of experience we come across. We all have to think through that. So I think let me go to one of the point that we have to make out. So vitamin D is not a medicine, but actually it's a part of our immunity system. Because of our lifestyles and because of our food systems, that we were not getting sufficient vitamin D. That's what, doctor, we can just comment out, because we are exposing to the sun, and many people are not having a proper D levels.
Yeah.
So that,
yeah. So yes, definitely. This is not part of our immune system. It is part of our body, which controls multiple, almost thousands of biological processes that go on in our body. Okay, immune system is one of them. Okay, and this is a it's a master regulator for many things. As I told you, it is a genetic expression modulator, gene expression modulator, and more of the disease is characterized by improper or it's a genetic disease. Okay, in the 21st century, more and more disease that we encounter is based on our improperly functioning genetic system. So vitamin D plays an important role there also. And there is one question in the comments here. And if there is vitamin D shortage, what do we do? So yes, if there can be a vitamin D shortage, and if that is the case, only thing that we need to do is eat proper diet and get exposed to the sun almost at from 11 o'clock to 3 o'clock sun. Get as much of your skin exposed to the sun as possible, and that you can manufacture. Your system can manufacture up to 10 to 12 or 20,000 units of vitamin D within 15 to 20 minutes. So, and that and also that is the reason why many of the people, when they say your lab report has the toxicity level of above 100. Okay, if you look at the lifeguards on the beaches here, by the time the summer is over, their levels reach 160 nanograms per ml. So it is not, so that happens naturally. They don't take any vitamin D supplementation. So vitamin D is, you hear horror stories about, if you look at Google, what all it can do. All these things that vitamin D can do is long term. If you maintain your vitamin D level around 300, 400, for 6 months to 1 year, that is when these things can happen. It is not, when you're taking it in high doses for short term to get over this pandemic and live through this pandemic, it will not be harmful.
Yeah, thanks, doctor. I think in parallel that when we are taking vitamin D3, so there are some of the food habits and the drinking water. I mean, some of the things that you suggested. So can you just help us and what all we can take, vitamin C or magnesium?
Yeah.
And exercises also. Can you cover that?
Yes, definitely. And whether COVID or no COVID, dehydration is extremely deadly. It is dangerous. Okay, most of the hospital admissions happen because of dehydration. Okay, and when you go into the hospital, you're dehydrated, and when they start giving you IV fluids, within 1 to 2 hours, you start feeling better. Okay, that is proof positive that the dehydration is a major problem. Okay. And also adults, just intermittent fasting is a very good thing, and that can help in making all our systems function properly. Okay? And it will increase, intermittent fasting will increase your insulin sensitivity. And as adults, we may not even need more than 2 meals a day. So that is, and also eat good amount of eggs along with the yellow yolk, and a lot of ghee. And ghee and eggs are superfoods of our of yesteryears, and they used to be part of our nutrition. And since we were so afraid of cardiovascular illness, and we have eliminated this, and we are suffering more from cardiovascular illness nowadays than ever before. And lower your carbohydrates. Okay, carbohydrates is the place where most of the toxic exposure comes from, these agricultural chemicals. Avoid these carbohydrates. If you can find goods of carbohydrates from good source, where there is no exposure to herbicides and pesticides and other things, yeah, you can do that. You can incorporate that. And 40 nanograms per ml is the minimum at which most of the enzymatic processes in our body come into play. And if we are at the minimum, we can it's not that is not optimal. Okay, so we can be prone to repeated infections and other chronic illness. Okay, and zinc, and I think you all know about zinc, and every prescription has zinc in it. that is being given to COVID. And vitamin C is a part of every prescription. And magnesium is extremely important. That is another thing that we all need to add to our diets, because modern diet is completely deficient in magnesium because of all the chelates that we use on our crops, food crops. And minerals are very important as well. So, healthy lifestyle is important. Maintaining your nutritional status is important. If we had been doing this for 1 year, past 1 year, the second wave would not have been this intense. There is no way. And let's, as with resolve, let's start implementing this. Let's do vitamin D correction, and let's increase our nutritional status. And you know what? We will be ready for any other pandemic or any other challenge that may come. That is sure to come in the days to come.
So, thank you, sir. So mainly, I think, as I mentioned earlier, so this is not intended to be a medical advice, neither is this to treat any illness. So mainly we have to correct, what God has given to us. So that vitamin D level, if we can make, in a sufficient level, then definitely that's one of the good things that we can overcome this COVID. So now I think before that, I just want to have one question, Dr. Sir. So because, now when we go to doctors, we keep on hearing, like, if you take this much of high doses, you may have toxicity and the kidney problems. And even you will lose the bone strength as well. And that's may not be doctors, but in common people, that's one of the understanding. Can you just please help us? Is this fears? Is it real, or is something else that we need to understand?
Okay. So yes, these are some questions that we need to address, because whenever we say vitamin D high doses, the toxicity comes into picture from any doctor's mind or anybody from Google. But if you look at it on balance, in the past 40 years worth of medical literature, there is not even one fatality reported because of vitamin D toxicity. Vitamin D toxicity can, even if it happens, it is correctable. Okay, and see, the thing is, since you're taking these doses, there are simple parameters that you can measure. Okay, your calcium level, your creatinine, and your kidney function tests. Okay, all these things, they are widely available and very cheap to get. Okay, you can get tested. Just take this, and if you take this and save your life, okay, we will have a lifetime of opportunity to protect ourselves from whatever toxicity that may happen. Okay? But if we don't, if we succumb to this disease, okay, in a matter of a week or two, okay, we don't even have to talk about toxicity at all. There is no life left. So I think we need to take a look at. I think we need to examine our literature once again. In the past 40 years, no fatality, no because of vitamin D toxicity. But yesterday, 3,500 people, according to official figures, 3,500 people gave up their lives to this pandemic.
Yeah, that was a really sad part of. Out of all this discussion, sir, I understood, like, vitamin D is not only for corona, but it is actually, for chronic disease in many areas. This is really helpful. So we have to monitor D levels, and we have to maintain that, proper levels. That's what actually I understood. That really keeps us our health, very, in a balanced way. That's what I understood.
Yes.
So I think time is up. I think, can we give 2 members, live questions we will take? And there are 2 to 3 questions. Quickly, I'll just run through that and we can answer. And probably for all the participants, one of the information we want to convey is, because some people are asking for, we have some questions and we want to take vitamin D3 and some guidance we require. So for that, we are giving 2 numbers. So those are we are displaying here. So let me display, so that you can just contact and take some guidance. So let me share.
Dr. Bhanu Garu, I have shared directly few questions. If you think that there are some valid ones, please take them up, Dr. Garu.
Okay. Okay. You shared it where?
Yeah, on chat, Dr. Garu. Chat directly to you, direct.
Okay.
If you want. Yes, please.
Yeah. So these are the numbers. You can contact these numbers. So mainly they will help you out. And there are certain people where they come across this COVID and recovered using vitamin D3 and taking the guidance of Bhanu Prasad Garu and helping out. So these are the numbers you can contact. And I think if possible, mostly next Saturday also, we want to continue these sessions. But the next time onwards, because we have one session in Telugu, one session in English, so which we have recorded, and next meeting onwards we want to take live questions, and we want to we will take more opportunity for all the audience and participants, so not audience, participants, and you can ask questions, and we'll get some answers from Dr. Bhanu Prasad Garu. So is that fine, sir?
Yeah. Yes. No problem.
So yeah.
Let me quickly, and I have to sign off in about 2 minutes, but let me quickly address these questions. Yeah. Yes, if you got the COVID vaccine and suffered for fever for 2 days, and there are some people who are suffering from fever for almost 10 plus days after the shot, and that fever is not responding to the dolo also in some people. So yeah, just hang in there and hydrate yourself. And vitamin D can definitely help this. And also, and the other question is how to control the cytokine storm. There is the only way that I know of is vitamin D. There are drugs that are available, that is tocilizumab or itolizumab, which is not to control the production of cytokines, but it is IL-6 receptor antibody. So IL-6 receptor antibody is like just taking out the IL-6 receptor, so that this IL-6, the massive amounts of IL-6 that are being generated, are don't affect the lungs that much. But that has not been proven effective at all in several studies. Several studies have completely shut down the efficacy of tocilizumab or itolizumab in this critical part of the illness. So cytokine storm means reduction of the production of these cytokines. That can only be done by proper vitamin D levels and properly pulsing the vitamin D when the person is in the active cytokine storm.
Yeah. So actually, I have two questions. I felt like these things we can ask. So one is like, my wife was administered the second dose of Covaxin vaccine yesterday. Along with body pains, she also experienced heaviness in her heart. Is it alarming or normal? And will it disappear with time or need medical intervention? She is under diabetes and cholesterol medication.
You know what? That is, if you have tightness in the chest and tightness of the heart, that has to be looked at right away, because have her examined by a cardiologist and get an echo and take a look at if there is any inflammation that is happening. Israel in the country of Israel, they have observed that there is this myocarditis that is happening post vaccination. So you cannot just sit down and relax, and please get her tested, and also just use vitamin D. If there is any immune related cytokine storm like reactions, vitamin D can help. But please do not neglect.
Yeah. Thanks, sir. I think maybe we will take from the participant. Can you just raise your hand so that I can unmute? Yeah, already Sudhir, who already unmuted. Can you please?
Sir, how are you?
Good, Sudhir.
Hi all. Are you hearing me, sir?
Yeah.
Sir,
we hear.
Actually, I vaccinated first dose Pfizer. I'm from Saudi Arabia, Riyadh. Okay, on 22nd April. Okay, last Thursday I feel loss of smell. Then I went for COVID test. I got positive. So I have 2 kids also. They also got positive, wife and kid. So wife, no symptom. Okay. My daughter has same symptom, loss of smell only, no fever, nothing. But today I feel little smell getting back. But what is your advice? I took antibiotic. One tablet yesterday and today 2 tablets. Before yesterday.
Yeah. Well, you know what, I think you're doing better, looks like. But
no
still,
symptoms, sir.
Yeah.
No any symptom. But
No,
I feel little smell today.
Yeah.
And I feel there is very 10% smell maybe.
That's wonderful. What it is, these symptoms, you need to keep monitoring it, because since you got vaccinated recently, let's see, keep monitoring it, 10th to the 20th day. And if you go get through this without any symptoms, that's wonderful. But consider increasing your vitamin D levels to bring them up.
You advise us to take vitamin D?
Absolutely. I think you should, every one of us, whether pandemic or no pandemic, vaccine or no vaccine, we need to bring up our vitamin D levels so that your body can function the way it is designed to.
Yeah, we'll take one more question from Eliza Paul.
థ్యాంక్ యూ అండి, థ్యాంక్ యూ వెరీ మచ్ డాక్టర్ గారు. నాకు ఒక వన్ వీక్ నుంచి కొంచెం సిమ్టమ్స్ కనపడుతున్నాయి. ఈ బెట్నసోల్ 4 డాక్సీ మాంటెక్ ఎల్సీ 3 వాడుతున్నానండి. దాంతోపాటు మీరు చెప్పిన డి విటమిన్ కూడా వాడుతున్నాను. అంతా బాగానే ఉందండి. అయితే మీరు చెప్పినట్టుగా లంగ్స్ లో ఫ్లూయిడ్స్, ఇది ఏదైనా ఇన్ఫెక్షన్ వస్తే దానికి ఏదైనా మెడిసిన్ మీరు ఏదైనా సజెస్ట్ చేస్తారా?
No, just fluids, your doctor will tell you how to get this mucus out very quickly. There are medicines like the mucolytics, like acetylcysteine. There's Mucinex. That is one of the brands there that can help in thinning the secretions, which tend to be very thick. And other than that, just monitor yourself, and if your pulse is going up, just follow the presentation that we used, and speak to your doctor about the evidence that we presented, and bring them along. You know what? This is a team effort, and the whole society has to come together to face this pandemic and face head on. Because without that, we will be dragged by our hair with this as this pandemic intensifies. Yeah, so you need to monitor your levels properly, and see if there is any chest tightness or any other symptoms, respiratory symptoms. Pay attention to them, and there is hope. Do not lose hope.
I'm sorry, I lost the connection. Sorry.
No, that's
yeah. So I think maybe we can wind up, as you have hurry up that you have to go back to the work. So thank you so much, doctor, for giving your time. And I believe all the participants, just note down from next Saturday at 4 o'clock, we are going to have question and answers, only for participants. And anybody is fine. Hindi or English or Telugu. Anyway, you can ask the question, and probably doctor will, try to answer those questions. So, and especially, so at this time, I just want to, call out, one thing I'm keep on hearing, everybody is saying that whenever we approach Dr. Bhanu Prasad Garu, and he's responding, and of course, he's getting a lot of calls. So I think we all have to understand. So that's why we have given 2 numbers. Please call to those numbers, and they will definitely guide you. And if at all, definitely need is there, and they will really, assist with the help of Dr. Bhanu Prasad Garu. So that's what actually I want all the participants to understand. And you can come up with questions, next week also, and we can have a good time. And this is what actually, we want to carry out. God has given a beautiful system in us, so which we are actually, missing a lot of things. I think probably this is the time where we have to, refill whatever actually we were having the gaps. I think, and Dr. Bhanu Prasad Garu, he believes in God, and especially the love of God that is actually, motivating him to stretch himself and to help and to save the people. And I heard, like, many people are, have a questions from the medical field. Doctors, they are actually asking, and he's saying that the one point he's saying, people are at risk. I can't really spend time to keep on discussing, and we want to go and try and see how the results are happening. That's what he's saying. So thank you so much, sir, and for giving this time. And I think we can wind up this session. Thank you so much, all the participants in YouTube and here who are connected. Yeah, thank you.
Thank you very much.
Yeah, thank you, Manana, for assisting me.
Thank you, brother.
Thank you.
Thank you, brother. God bless you.
And thank you, Dr. Vijay and Dr. Saroja garu, for your valuable experiences you have shared. So I'm ending this meeting. Thank you. Thank you.
Yeah. Thank you. Thank you. Thank you.
Yeah.
God bless you all. Take care.
Yeah, I think one information, I think some of the people are, facing getting vitamin D tablets. And I know one of the brother who is actually helping in a service motive. So his name is Brother Sudhakar Reddy Garu. So from his company, they are giving 50% discount just for the sake of service. They are not getting much profit even on that. And I'm going to share that number, and you can just note down, and you can call, and they can actually do courier of the medicine. So let me paste here. So by the way, this is not for marketing, because it's the main of people are suffering, not able to get the tablet. That's why we are actually giving this number. So please make use of it. Thank you. So let me share the screen, and you can have that number noted. Yeah, here is the number: 99 66 66 77 50. 99 66 66 77 50. Thank you.